Let's face it, sometimes there can be some dreaded words when it comes to your health, and two of those for people might very well be rotator cuff. If you've ever known anyone who's had rotator cuff surgery, no doubt you're doing everything you can to avoid it. So we're very happy this morning to welcome Dr. Todd Bell. He is with the Center for Sports Medicine and joins us to talk about what a rotator cuff disease looks like, how it's different from a torn muscle, and what some of your options might be to treat it. So good to see you this morning.
Good to see you.
Maybe it's not fair that I mentioned kind of the worrisome nature of rotator cuff surgery. One of my brothers had that recently, and you can get through it. It's just not the first choice. Is that right?
That's true. Rotator cuff disease, oftentimes we can manage it non-surgically and get symptom relief with things like anti-inflammatories and rehab exercises, and sometimes cortisone injections can be helpful.
Does it develop, when you talk about it being a disease and the inflammation that can go with it, does it tend to kind of sneak up on people much like arthritis can?
It can present in a couple of different ways. Sometimes it's a gradual development of symptoms. Sometimes there's a injury or an event that leads to the development of symptoms, and sometimes it's related to overuse or doing an unusual activity excessively.
So when you begin to suspect that that might be what you're dealing with as a person coming into your office, do you typically have some common symptoms before you make that appointment?
Rotator cuff problems typically present with shoulder pain either on the side or the back or the front of the shoulder, and sometimes it radiates down the side of the arm down to the region just above the elbow. And that's what we commonly see. And typically people complain of pain with reaching, raising their arms overhead, or lifting. Also, night pain is really common, where people just have a lot of continuous aching pain at night trying to get to sleep.
So it's not then a torn muscle. Is a rotator cuff disease, is it always inflammation?
Well, there's a range of rotator cuff problems, and it typically involves the set of muscles and tendons in the shoulder there's 4 of them that constitute the rotator cuff. And it can range from inflammatory problems like tendonitis and bursitis to partial tears or full thickness tears of the rotator cuff.
So are there some things that we do? I mean, I would imagine if you're an athlete, if you're a tennis player or something like that, you might be more prone to developing these problems. But for the lay person out there, are there some things that we do that tend to contribute?
Yes, there's activities that involve a lot of reaching or raising overhead can contribute to rotator cuff disease over time. So certain occupations, laborers, electricians, also hairdressers get a lot of rotator cuff problems because there's a lot of movement of the arms away from the body. But really, anybody can develop these problems.
So when somebody comes in to see you, I know you've got patients out there waiting to see you this morning. Obviously, you have to examine each one and determine what type of rotator cuff issue he or she is dealing with. But do you have more than one way to non-surgically attack this?
The range of non-surgical options would be, I think the most helpful probably is rotator cuff rehab exercises, and they're fairly simple to do. Anti-inflammatories like Advil and Aleve can be helpful in the short term. Sometimes we use cortisone injections to provide temporary relief, but I don't think that's a good thing to do repeatedly for a rotator cuff problem.
So if at some point surgery then becomes the only other option, at what point do you typically make that decision?
Well, rotator cuff tears occur when the tendon tears away from the bone, and those cannot heal themselves. And so if there's a significant rotator cuff tear that's causing symptoms that are not responding to non-surgical treatments, then we consider surgical intervention, which would be typically an arthroscopic surgery to repair the rotator cuff.
All right, Dr. Todd Bell, thank you so much for your time this morning, and for the patients who were kind enough to let you talk to us, give them our thanks as well.
Thank you.
You can find him at the Center for Sports Medicine. Of course, they have locations all around town, but the number on Macaulay Avenue might be the easiest one for you to start with, 624-2696, online at sportmed.com. Be careful when you're doing that reaching overhead. Thanks again.
Thank you.